Hello, everyone. My name is Nikki Dykema, and I'm a representative of BC Pension Corporation. I'm very happy to be your moderator for this webinar. Joining us today are a mix of retired plan members, as well as active members who are nearing retirement. Welcome to you all, and thank you for making the time for us today. I'm now pleased to introduce you to Tom Vincent. Tom is the chair of the Public Service Pension Board of Trustees and chair of the subcommittee who reviewed health benefits for retired members. Tom was appointed to the board by the provincial government and has worked in the area of pensions for 24 years. He has also been a member of the Teachers Pension Board of Trustees, and before joint trusteeship, he was a member of the Municipal Pension Advisory Board. I'd like to turn things over to Tom to get us started. Welcome, Tom.
Thank you, Nikki. So hello. On behalf of the Public Service Pension Board of Trustees, welcome to this webinar about changes to your retirement group drug plan. The board has now completed its review of the plan's retirement group health benefits, including much time collecting and analyzing price and volume trends, usage data, examining best practices, and soliciting the input of plan members through our consultation process. Based on this, the board has made changes to the drug plan. We're now pleased to describe these and how you are affected. Joanne Jung will be delivering today's webinar. She has 27 years of pharmacy experience, leads the Willis Towers Watson National Team of Pharmacy Experts, and is known for her success as an innovator in hospital clinical pharmacy practice. Joanne has published several research papers in the pharmacy field and is a sought-after speaker at industry events. She has been of tremendous value to the board as it adjusted the plan and dealt with our provider on myriad implementation details. Joanne.
Thank you very much, Tom. So good morning, everybody. It's a pleasure to be here. Thank you for coming to this, attending this webinar. It's something that's very important to you and for the plan. And we're going to start by, answering some questions you might have about why is this happening? Why are we modernizing your plan? And as well, we'd like to share with you a recap of your current plan so you can understand where we're starting, the specific rules of the plan, as well as the changes and how we came about to those changes. So there is a growing number of retirees and the cost of drugs are rising quite dramatically. The number of health benefits program participants are over 42,000 members as of this past summer. The average age of retired members is 72 years, and the amount spent on drugs is $27 million per year, with a trend of growing at over 3.3% year over year on a per capita basis. In addition to that, the actual annual increase in the amount spent on drugs under your plan has grown by over 6%. Before we entered into the modernization of your drug plan, we always stayed true to the public service pension plan benefits philosophy. The key philosophy point is to protect against catastrophic health expenses, as well as cover cost-effective medications. Not all medications on the market are equal in value. So the focus is to optimize that value and to structure the plan such as, so we are steering towards drugs that are most cost-effective. And sustainability is key. If we continue at the current trend at which we see drugs growing, the plan may not be sustainable well into the future. So we're making some adjustments to improve the sustainability so that this drug plan is available well decades down the road. And the last piece, and a very important piece of this change, is to leverage public drug programs that are available. There's available funding for all British Columbians, and the key design is to make sure we leverage that funding as much as possible to help shift costs from the private side over to the public. So currently, under your extended health care coverage, your plan covers all medically necessary prescription drugs that are prescribed by your doctor, with a few exceptions. Your plan has a $250 deductible. So it's a deductible that you pay out of pocket at the start of every calendar year. It's similar to if you have an insurance claim, you pay a certain amount out of pocket, which is a deductible, before the insurance starts supplementing your plan. So after the $250 deductible that you pay at the start of every calendar year, then 70% of the eligible cost of prescription medications will be paid by the plan until you reach total claims, which includes other extended healthcare claims such as vision, physiotherapy. If those total claims reach $2,000, then the plan starts paying 100% of eligible costs. So there's 100% of reimbursement after you reach $2,000 worth of claims. The plan also has a lifetime maximum of $250,000. It was increased from $200,000 in 2019. And there's also a maximum dispensing fee. Today, that limit is $10, which is the average price in British Columbia when you compare different pharmacies. And it also aligns with PharmaCare's maximum dispensing fee, which is also $10. So PharmaCare increases or decreases its dispensing fee that it pays, then your plan will also align with that and change with PharmaCare. So before we start talking about the changes, I want to pause for a minute and talk about drug formularies. A drug formulary is essentially a list of drugs covered by your plan. The most common type of formulary that we see in private drug plans is called an open formulary, and that's the current formulary that you have under Green Shield Canada. Under that formulary, all drugs are covered at the same co-insurance level, which is currently at 70%. But there's other types of formularies. Another type of formulary is what we call a tiered formulary. That's a formulary where you have your drugs in two different groupings. You have a preferred grouping where you get higher reimbursement or higher coverage for those preferred drugs. And then you have non-preferred drugs where you would have less coverage or lower reimbursement. And this is a very common plan design that's gaining traction amongst private drug plans in Canada. And almost over 90% of private drug plans in the US have a tiered model where you still cover all the drugs, but you cover them at different co-insurance levels. And then finally, a different type of formulary is called a closed formulary. A closed formulary only covers a select group of drugs. If your prescription is not within that select group of drugs, it is not reimbursed at all by the plan. Most public formularies have a closed formulary, such as BC PharmaCare and all the other provincial formularies all have a closed formulary, as well as a hospital, for example. They will also have a closed formulary. Formulary determines the number of drugs that are covered under your plan, but there are also different pricing rules. So under your plan today, you have certain rules for coverage that determines how much is reimbursed for your prescription medication. The first one is called low-cost alternative. Another name for this might be generic substitution plan. What it means is the plan, if there's a generic alternative for your medication and you choose to get the brand version, the plan will only pay up to the low-cost alternative, or otherwise known as a generic price. So if the brand is $1, and the generic is 20 cents, if you fill your prescription for the brand drug, the plan will only reimburse up to 20 cents per pill. So that's low cost alternative. The second pricing rule that exists under your plan today is called Reference Drug Program. And it's a program that's that PharmaCare has, that your plan follows and always has followed for several decades when PharmaCare introduced this program, I believe in the 90s. And what this is, it pays up to the lowest price within a certain drug category. So, for example, amongst drugs that treat cholesterol, it will pay up to the lowest price drug within that category. So these drugs are not brands and generics. These drugs are similar and they're related to each other and within the same family. So that's the Reference Drug Program. And then finally, the newest program that was added to your drug plan a few years ago is called the Biosimilars Initiative. So biosimilars are less costly versions of biologic drugs. Biologics are more complex drugs that are given by injection, and most of them cost over $10,000 per person per year. But there are also cheaper versions of biologics like insulins and vaccines. Once a biologic loses its patent protection, then what other manufacturers can produce are called biosimilars. So it's very similar to a generic version, but we can't call it a generic because they're more complex. But what this means is that your plan, if there's a biosimilar version of a drug, for example, insulin Lantus, today your plan will only cover the biosimilar version, which is called Basaglar. And that is something, if you were on insulin Lantus, you would have received a letter from Green Shield asking you to switch to the biosimilar version because it is less costly and it again is following the BC PharmaCare biosimilar program. So those are the three elements that I want you to be aware of that are currently under your current plan design, and these will all continue when we shift over to the new design. So now let's talk about how we are modernizing the drug plan and why we are doing this. We're making these changes because the status quo is not sustainable. We often refer to this as the cost of doing nothing. There's a really good opportunity now because there are enough funds for your plan to be sustainable within the next few years, but the way things are going, the way that the cost of drugs are increasing, we need to ensure that your extended drug plan is available for you and others well into the future. With a changing landscape, the cost of drugs are the most volatile under your drug plan. Right now, we have drugs on the market that are cost over $1 million per year. We have a growing number of drugs that are in the price tag of $10,000 a year and above. And the majority of drugs in research and development are what we call specialty drugs. And these are drugs that are very expensive and more specialized, and they're being used to treat conditions like cancer, autoimmune diseases like rheumatoid arthritis, and they're also being used to treat more chronic conditions like migraine headaches or eczema. So this is something that most drug plans are watching very carefully. And under your extended healthcare program, almost 70% of the costs are drugs. So drugs do make up 70% of your program. So that's why we are focusing on your prescription drug plan. And our focus really is favoring drugs that offer the best value based on clinical evidence. So before we fine-tune the changes, as many of you may know, we did have a member engagement survey. It was an online survey that was conducted last fall of 2020 following a webinar similar to this, where we were explaining the current drug plan, and some of you may have participated in that webinar. And we were also presenting some of the options that the board was considering with the modernization. The online survey had about 1,350 respondents, approximately 51% male, 48% female, and 1% of the respondents preferred not to indicate what gender they were. And there were 3 options presented. So of the respondents that participated in the online survey, 77% of them were retired members currently in the plan. 17% were active employees who are within 5 years of retirement. So just like today's session, the board did invite the soon-to-be retired active workers to participate in the survey. And then 4% of the respondents were either spouses or dependents of members within the extended health benefits plan. So when we tallied all the results of the survey, we found that 64% of the respondents ranked this new plan design that we're about to present to you as their first choice of the 3 options. So there was a very clear leader or design that the majority of the responses selected as their number 1 option. And I'm happy to report that that is the option that the board decided to proceed with. So let's talk about what this new plan design is going to be like. So what exactly is changing? So currently, after you pay your $250 extended healthcare deductible at the beginning of each calendar year, the plan starts covering 70% of all your prescriptions, and this will continue until December 31st of this year. So that's your current plan design. What's happening with the change is that nobody will lose coverage of their drugs. But what will happen is there will be a shift to what we call a tiered formulary. So there will be 2 levels of reimbursement, and the reimbursement will be based on BC PharmaCare's formulary. This will take effect January 1st of 2022. How it will work is that if your drug, that your prescription that you're on is covered by BC PharmaCare, so if it's on BC PharmaCare's formulary, it will be reimbursed at a higher level than it is today. So that will increase to 80% coverage. If it's not covered by BC PharmaCare, then it will be covered at 60%. So coverage will decrease. We will talk more in depth about BC PharmaCare, how you will know whether your prescription's on BC PharmaCare's formulary or not, and also the steps that the board decisions that have been made to help ease this transition once this plan takes effect January 1st of 2022. So why are we building it around BC PharmaCare? BC PharmaCare is the provincial drug formulary available to all BC residents. It covers a very comprehensive list of drugs for British Columbians. They have a very robust expert review committee that selects drugs that are included on its formulary based on clinical evidence as well as value. Most drugs that come to the market do not, even though they come onto the market and they are more expensive than drugs that are treating the same condition, most of them have not been proven to have greater value. So the analogy I like to use is a Cadillac that gets you from A to B versus a Honda Civic. Do you have to have the Cadillac? So that would not be a car that has value. It uses more gas. There may be some items that are not necessary versus a reliable Honda Civic that still gets you from A to B very safely. The good news is that 80% of you, so 80% of members enrolled in extended healthcare coverage under the PSPP plan today are claiming a drug that is covered by BC PharmaCare. So you should expect to see increased coverage from your current 70% coverage up to 80% because you have a drug already that's on the PharmaCare formulary. The other aspect of BC PharmaCare that's very favorable is that it's a familiar formulary to all health practitioners like doctors, pharmacists. So when you go to your doctor and there are choices for your therapeutic condition, you can tell your doctor, please prescribe me a drug that is on the BC PharmaCare formulary, and the doctors are very familiar with it. In addition to that, there are great online tools that are continuously being updated, and they also have their own prior authorization process that many of you already go through today to get access to coverage for high cost drugs. So that process will not change. But if you do that more for your pharmacare drugs that do require special authority, then you will get increased reimbursement and get 80% coverage instead of 70%. And I'll talk more about special authority later in the presentation. And the key aspect of pharmacare and favoring drugs that are on the pharmacare formulary is that the more you use the drugs, the more you save the plan money and the more you save yourself money. So just to recap some of the benefits of the BC Pharmacare formulary, funding for BC Pharmacare drugs are available to all BC residents, and I will illustrate how that will work. After the plan pays your annual deductible, which is the $250 that all of you pay out of pocket before you get any coverage under the extended healthcare plan with Green Shield, if the drug is on the BC Pharmacare formulary, BC Pharmacare starts paying for the drug. And that's after pharmacare formulary. So I just wanted to be clear, there are two deductibles, your plan deductible of $250, and then there's also a BC Pharmacare annual deductible that is income-based. And as I walk through the example, I think it'll be more clear how it all works. This BC Pharmacare annual deductible is based on net household income, and it's usually approximately 3%, but that varies based on the year you're born and also income level. So they have a table on their website that'll explain exactly what your deductible would be based on your net household income. So let's illustrate with an example using Mr. Parker, who is a 70-year-old retiree with a net income of $50,000, in part from his pension and other investment income that he might have. We're using 50,000 because it's a very clean number to use, easy to do the math. So let's say based on a $50,000 household income, his annual pharmacare deductible would be $1,500 because 3% of $50,000 is $1,500. So as Mr. Parker starts filling his prescriptions from January 1st, his prescriptions, he's on multiple medications because he has diabetes as well as high blood pressure. So as he's filling his medications, and if the medications are on the BC Pharmacare formulary, when they start, his prescription costs start accumulating to $1,500, then what will happen there is that pharmacare will start paying for part of that prescription after that threshold. But as he starts reaching $1,500, he doesn't have to pay all of that out of pocket. The only thing he needs to pay is a $250 out-of-pocket deductible. That's part of his extended health plan. That's not related to pharmacare. And then after that, Green Shield will start paying 80% of his prescriptions when before it would have been 70%. So that'll continue to pay. And when he accumulates to $1,500, then the good news is the cost will start shifting to pharmacare. And after $1,500, any prescriptions that are filled after he reaches that threshold, so let's say he reaches that threshold in June, the prescriptions that he fills after June, 70% of the cost of those prescriptions will be paid for by BC Pharmacare, and then the 30% will be paid for by Green Shield, but he'll still be subject to all the plan rules. So it's only the 30% that would be paid for by the plan. That's the point at which drugs start shifting to pharmacare. But there's another threshold that all British Columbians have, and that's called your family maxima, which is approximately 4% of your net family income. So at Mr. Parker, after he accumulates to $1,500, and then pharmacare starts paying 70% of his prescriptions, when he reaches $2,000, so the 30% that's paid for by the plan, when it accumulates to another $500 to reach $2,000, which is 4% of your net family income of $50,000, then what happens is pharmacare pays 100%. So I don't want you to get too worked up on the details or the numbers, but it's just an illustration to show why it's really favorable for both you and the plan to use pharmacare eligible drugs. And that's because everybody has a threshold, a family maximum, after which pharmacare starts paying for the drug. So once pharmacare starts paying 100%, neither you nor the plan have to pay any dollars for this prescription going forward, and pharmacare will start to pay for that drug for the balance of the calendar year, as well as anyone in your household that's prescribed a pharmacare formulary drug, they will also pay $0 for their prescription. And pharmacists are not allowed to pass any surplus markup or any excess to you. So they're not allowed to charge you anything out of pocket after you reach your family maximum. So what I'll do now is pause and turn it back to Nikki so she can field questions that you might have before we move on in the presentation.
Thank you, Joanne. So we'll stop now to take a few questions. Our first question is for Tom. Tom, please advise what forward-looking strategy has been put in place for planning when universal pharmacare is implemented. There is a patented drug pricing review that has taken place federally, and that too will have an impact on the cost of drugs once implemented. So what is the impact on our plan once implemented?
Well, there's two questions there. I'll deal with the national pharmacare question first. It's something we looked at very, very closely as we were designing these changes. And it was a policy plank for the current government at one time. Going into the most recent federal election, however, the party which now forms government didn't express any intent to ramp up its efforts toward universal pharmacare. And we can only conclude from that it chose national daycare as its policy priority over national pharmacare for probably very good reasons. So it's unlikely that there will be a national first payer pharmacare program in the near future. And we designed our program with that in mind. Now, obviously, if at some point in the future the circumstances change, then we will examine the program within our funding availability and the changed context. We would expect the effect on the public service pension plan to be small, though, since there's already coordination with a public drug plan, namely the pharmacare plan, and that connection is going to be even stronger starting in January than it is now. As well, the funding toward a national strategy for drugs is quite possibly going to focus on rare diseases, and that is unlikely to affect public service pension plan members as those drugs typically treat a much younger population. So I'll just stop there on the national pharmacare piece. The other part of the question indicates an extraordinarily well-informed group of people listening to our webinar, which is delightful. So the Patented Medicine Prices Review Board is intended only to apply to new and recently approved patented drugs. So it won't really affect our base and the growth on our base. It may affect the rate of growth favorably. And we have, when we identified the need to make changes, we identified best case, worst case, and most probable case scenarios for how long the existing plan would work out. And if there were to be a substantial positive effect from the Patented Medicine Prices Review Board, that would push us more toward one of the more favorable scenarios that we examined. And it doesn't change the imperative to make changes to the plan, but it makes the runway before we would otherwise have exhausted existing funding a little longer. I should just note that this Patented Medicine Prices Review Board at the federal level is expected to come into force on the 1st of January 2022, but it has already been postponed 3 times. And so our confidence level that it's going to proceed as planned has been affected by those 3 postponements. Hopefully it will come in as scheduled, but clearly the people at the federal level are experiencing some complexities, and some of that may well relate to COVID.
And just to add to that, Tom, it's been postponed 3 times already, and we're already hearing rumors they may be postponed further to July 1st of 2022, even though officially it's supposed to take effect January 1st. There's lots of pushback from pharmaceutical manufacturers because they're not very happy with this new framework or methodology.
Thanks, Joanne.
Yeah, thanks for that info. So we have a second question now. This is also for Tom, different topic. New Zealand has a model they employ in their drug planning. Is there any linkage in the BC plan with the New Zealand plan?
The short answer is no. The slightly longer answer is that we examined models from all over the world when we designed what we have here. We have to take our design in the context that affects our plan members. And our plan members are affected by the environment in British Columbia with respect to both drug prices, dispensing fees, and the pharmacare program in British Columbia. The national context is also important in British Columbia because it affects the length of patent protection on brand name drugs. That is how long the drug will be a brand name protected before it becomes available to generic companies to make chemical equivalents to the brand name. And that's very different in New Zealand from what it is here in Canada.
I just want to add to the New Zealand model. Yes, they save money, but it's a very, very restrictive formulary. And the other issue with New Zealand's model is that they do a tendering model. So there was a few years ago, the Canadian Generic Association and the government entered into a 5-year contract. So in exchange for that, the generic companies said, we'll lower generic prices even more, but please don't go to a tendering model like New Zealand. The issue with the tendering model is that there are drug shortages, because if you only have one supplier for a drug, you are faced with tremendous drug shortages, and Canada on a global level is a very small market. So we're already seeing shortages today. So I can't imagine if we went to that model, we would see much more shortages as well.
Great, thanks for that, Joanne. I'll bring the next question to you. And is there a list available for us to check if a drug on the if our drug is on the pharmacare formulary list?
Yes, there is. There's an online tool, and I will be walking you through the online tool so everybody can go to the tool and look it up. It's not, but I think it's good to walk through it because there are some technical aspects of it that I would like the participants to be aware of. Awesome. But yes, there are lots of good tools.
Excellent. Okay, so we'll do one more question for Joanne and then we'll move on. Is the net income adjusted for each member annually for the plan?
Yeah, that's a great question. So yes, there is. So most of you probably have registered for what you call Fair Pharmacare. And it's a requirement after you accumulate to a certain threshold of drugs. Green Shield will not continue paying for drugs until you've proven you've registered for Fair Pharmacare. What that does is it authorizes Pharmacare to have access to your income tax, your net income from your income tax. So when you file your income taxes and pharmacare, we'll get that information. And if you've had a dramatic change, like a dramatic reduction prior to 2 years before, because they calculated on 2 years previous, then you can always apply for an adjustment with pharmacare.
Great. So thank you, Joanne. Why don't we continue on and we'll get back to our questions at the end of the presentation.
Okay, so just to recap the review of the new design, this is a chart that just shows it in a different format. So it gives us an overview of the changes to the drug plan. So someone did ask the question about a national formulary. If we did go to a national formulary, it would be a very likely a restricted number of drugs that would be covered, just as if today you didn't have a private drug plan or some of the other private drug plans are available, only cover drugs that are on the pharmacare formulary. So with this new design, there's no loss in coverage. All drugs are still covered today, but just at different levels. So going from today's formulary, which is an open formulary, and drugs are reimbursed at 70%, with the new plan that takes effect on January 1st, 2022, if the drug is covered, if your prescription drug is covered by BC Pharmacare, then it will increase to 80%. So that would be a general benefit. So there are two groupings of pharmacare drugs. You have your general benefits, which the majority of drugs are general benefits. You don't need any prior approval before they're covered. And those drugs will automatically increase to 80%. However, there are a few hundred drugs that are considered special authority drugs. And there will be 80% coverage if those drugs are approved by BC Pharmacare. So just like today, if your drug's covered by BC Pharmacare, then the pharmacy, once they submit that claim through the pharmacy, Green Shield will be notified right away, and they will increase your reimbursement to 80%. And I'll talk more about special authority drugs in the next slide. On the non-pharmacare side, though, if it is not under the pharmacare formulary, the plan will cover it at 60%. So the coverage will be reduced by 10%, but not right away. I'll explain how that will work. So just to talk a little bit now about BC Pharmacare special authority drugs. So under the formulary of BC Pharmacare, there is a subset of a few hundred high-cost drugs that require special authority or pre-approval from Pharmacare before they're eligible for coverage. There are three reasons for this. First of all, these drugs are more expensive, but equally safe and effective as other drugs for the same condition that might be cheaper. Pharmacare may want to ensure that you have tried a cheaper alternative first before they approve this more expensive drug. All private plans also have a prior authorization list for their expensive drugs. So today, if you're on one of the expensive drugs, you would have either have gone to Pharmacare for prior approval or Green Shield for prior approval. So it's a similar process, but we encourage you, if it's a Pharmacare special authority drug, that you get approval from Pharmacare, so you get reimbursed at the higher 80%. The second reason for having special authority approval for this group of drugs is a drug may be selective and only work for certain patients. So for example, there are drugs who have only been studied and designed for patients with a more severe form of a disease. So by filling out the form, your doctor will just indicate to Pharmacare that if you need an expensive drug for rheumatoid arthritis, for example, that you have a more severe form of that disease. And finally, special authority ensures appropriate use of the more costly drugs. This isn't just about cost savings, but it's also about potential safety. Because the drug is being used, we want to make sure through prior authorization that the drug is being used appropriately and according to indications approved by Health Canada, because sometimes there's experimental use of some of these medications. The plan or Pharmacare will not approve these drugs if they're not used for the Health Canada approved indications. So the process for getting Pharmacare special authority approval is fairly straightforward. And remember, the majority of pharmacare eligible drugs do not have this requirement. It's just a smaller subset. Physicians in BC are very familiar with which drugs require special authority. They know where to retrieve the forms and where to send the request. And believe me, specialists in British Columbia are filling out these forms quite regularly. And many of these drugs, expensive medications, have patient support programs that will help patients navigate reimbursement and help them send these forms to BC Pharmacare as well. So if your drug is approved by BC Pharmacare, it will be covered on Tier 1 at 80%. If you do not meet Pharmacare's criteria and the drug is denied by Pharmacare, the drug will be covered on Tier 2 and receive 60% reimbursement. But if it is denied by BC Pharmacare, you still need to apply to Green Shield for their prior authorization process before you even get coverage at all. And that's always been a standard process under your plan with Green Shield. So if you do not get, if Pharmacare denies and Green Shield approves, you will get 60% reimbursement for your drug. Just want to remind everybody, some of you may already have special authority approval, so you do not need to reapply to Pharmacare for special authority when we transition to this new design. But just make sure your approval is up to date, as some drugs require the approvals to be renewed after a few years. So now I'm going to take some time to go over a demo of Pharmacare Formulary Search. I'm sure many of you are wondering, is my drug covered by BC Pharmacare? If you Google BC Pharmacare Formulary Search on your search engine, usually you will come up to this page, which says, welcome to the BC Pharmacare Formulary Search. At the bottom is this box that you would click that says Search BC Pharmacare Formulary. Then you will be brought to this page. Sometimes when you do your Google search of BC Pharmacare Formulary, you will go directly to this page. So I'm going to walk you through how you would go about searching your drug. So this is a pretty user-friendly search engine because you can put in your generic name, you can put in the brand name, or you can put in your drug identification number. Every drug approved for market in Canada has what you call a drug identification number. And if you have your prescription in front of you, there will be an 8-digit number that you would enter into this field. But what I'll do is an example of a generic drug, atorvastatin, which is used for cholesterol. So a number of atorvastatins come up, but just pick one and then hit search at the bottom. So you can see that there's many different forms of atorvastatin because there's different brands, there are combination products, and there's several different pages. But the unique identifier is your drug identification number. So if you want to go to, if you're on a Sandoz Canada 20 milligram atorvastatin, you can just click on here. So it's very key to click on to the highlighted drug identification number. So here, there's a pop-up, go back, that'll show you whether the drug is covered by Pharmacare or not. And you will see many different types of Pharmacare plans like First Nations, residential, at home. What we're looking for is Fair Pharmacare. So if it shows Fair Pharmacare, it means that, yes, it is on the Pharmacare formulary. The maximum Pharmacare covers is $23.53 per tablet. That is the same as what your plan covers per tablet, which includes the pharmacy markup. And there's other interesting information, like is it under the reference drug program, which I explained earlier. Your plan follows the reference drug program, so it is not. And the maximum day supply per fill is 100 days. So there's a lot of useful information under this tool. So there's also information here of how much it covers per tablet, what the unit is, and whether special authority is needed. And sometimes there's special quantity limits. So most plans default to covering, Pharmacare defaults to covering about 100-day supply, but some drugs are more restrictive and may only cover a month. So it might say 35 days here, or there might be a quantity of the pill. So this shows you that atorvastatin is covered. So then you can go and do a new search. So I'm going to find an example of a drug that is special authority. So I will pick a drug called Inflectra. So type in Inflectra, you hit the search engine, and you will see that it comes up. Now here, again, it's important to click on to the DIN, and it will say available special authority only. The maximum pharmacare covers is the unit cost that it covers per injection. This is an injectable drug, and the maximum day supply is 56 days. So you can see that it is covered with special authority. Now, as far as the forms, that's up to your doctor to pull those forms up. So your doctor will be familiar with these types of special authority drugs. They're mainly prescribed by specialists, and they're very familiar with how to apply and accessing all the forms and having the right criteria. But I just wanted to demonstrate this in case you are on this drug and you want to know whether it's covered by pharmacare or not. And you can see under the special authority column, it does say yes. And whatever's highlighted in blue is a hyperlink, and you can go in and it'll give you more information. So then this goes on to the special authority website. Now I'm going to give you an example of a drug that's not covered by pharmacare. It's called Xolair. So interesting, when you search for Xolair, it comes up. So that's why it's very important to click into the DIN number of the particular strength that you're on. And if you click on to the DIN number, you will see that it says it's a non-benefit. So even though it displayed when you search Xolair, when you click into the DIN, you will see that Xolair is a non-benefit. So if you are prescribed Xolair, it is a specialty, it's a prior authorization drug under Green Shield. So you would still need to apply to Green Shield for prior authorization, but it would be covered at 60% rather than 80%. Another hint to suggest that it's not covered by pharmacare is under the maximum pharmacare covers column, you will not see any dollar figures. And usually when you see this as being blank, it will tell you, it usually means that it's not covered by BC Pharmacare. So, but confirming it by clicking in the name of the DIN, which will tell you non-benefit. Now let's enter a drug that may not be covered by BC Pharmacare at all. I will pick a drug called Soliris. So if the drug that you type in and you make sure you double check the spelling or the DIN, if it's not covered by BC Pharmacare, many of the drugs that are not covered will not even display like the Xolair did. So you can see that this pop-up came up and said, no drugs found for selected criteria. So if it doesn't even display and you get a pop-up like this, then it likely is that the drug is not covered by BC Pharmacare. So those are the main examples that I wanted to show you, an example of a regularly covered drug, a special authority drug, and a non-covered drug. So this is a very good tool that you can go to. If you need confirmation about your drug, you can always ask your pharmacist or your physician. So that was the demo.
Maybe, Joanne, just because you've been so immersed in pharmacy all your life, I've got jargon in my discipline. DIN.
That's the drug identification number.
Good.
So that was the 8-digit number that you enter into the search. So you can search by the DIN.
Great, thanks.
Or the drug name. But thank you for bringing that up. I want to pause now to talk about the grace period, because we do recognize that this change is coming up fairly soon in a short number of months. And some of you may be on a non-pharmacare drug for a chronic condition, and you might want to see your doctor about potentially switching to a pharmacare eligible drug that treats the same condition. So for certain chronic conditions, or most of them, where there may be a risk if you abruptly discontinue or change therapy, the Health Benefits Program will continue to provide coverage at the current level, which is 70%, for the duration of next year, which is 2022, until December 31st. So this grace period was preferred by the majority of respondents on last year's member engagement survey. So that's why the board is offering this grace period. So plan members who will not lose coverage and will have time to take action if they so desire. But for the duration of 2022, there will be a grace period where you will not lose coverage and be retained at 70% for a non-pharmacare drug for a chronic condition. So the question you might ask yourself is, what if my drug is not covered by BC Pharmacare? There are 3 options to make sure you do not lose coverage after the 1-year grace period. As a reminder, we have that 1-year grace period available for 2022. But one thing you can do next year or after January 1st of 2023 is that we're giving you the year to be able to have these discussions with your doctor about eligible pharmacare treatment options and possibly change your drug. I've worked with a few very large groups who went to a pharmacare formulary, and many did select that option. So we did see change from a non-pharmacare drug over to a pharmacare eligible drug. So in that particular situation, the design actually had no coverage for non-pharmacare drugs, and there was no grace period. And if you choose to remain on your drug that you are taking beyond the grace period, it will drop to a 60% coinsurance starting January 1st of 2023 after the grace period ends. And the other option might be if you do have a spouse that also has a private health benefits plan, there may be coverage for the balance, the 40% balance that will not be paid by your plan, by your spouse's plan, if there is one. So that's another option that's possible, or you will pay out of pocket for the 40% balance, when before it was a 30% balance. So we are currently working very closely with GreenShield as they are preparing their systems for this change. As a reminder, due to privacy, the board or pension corp has no access to specific member drug information. So GreenShield is running an analysis to identify any plan members, spouses, or dependents who are eligible for a grace period of being reimbursed at 70% for 1 year before coverage drops to 60% in 2023. So if you recently claimed a non-pharmacare drug for a chronic condition before January 1st of 2022, you will receive a letter to outline next steps and options. Want to remind everybody that because you will be notified by mail, please make sure your address on file is current. You can sign on or register for My Account at myaccount.pensionsbc.ca to update your contact information, and that information will be passed on to GreenShield so they have the right address when they mail the letters. So here's a recap and timeline of the upcoming plan changes. So in July, the board announced to retirement group health benefit members that changes were coming to the plan. Today, we are presenting the webinar to you as the audience, and a recording of this webinar will be available online for any plan members who missed one of the live sessions. Following the webinars this week, starting in later October and into early January, affected plan members who are currently on a chronic drug that is not on the pharmacare formulary will receive a letter from GreenShield on next steps that I outlined previously. Starting January 1st of 2022, the new plan design takes effect. Note that the majority of prescriptions will have increased coverage under the new design. So when we did analysis, the majority of members, or 95% in fact, are taking a prescription that is on the pharmacare formula already. And anyone who is taking a non-pharmacare drug will not lose coverage for 12 months. Green Shield's contact center is available from January 4th to answer specific questions. And the Public Service Pension Plan Benefits Committee has been working very closely with Green Shield over the last year or more, and the Pension Corp and consultants on managing this change. For the grace period, I want to remind you that if you are an active employee that was on a drug and then you enter the plan after January 1st of 2022, there will be no grace period because you're transitioning to a new plan. So it's only existing plan members who are currently in the post-retirement group benefit plan that will have a grace period. Then on January 1st of 2023, the grace period will end, and anybody still claiming a tier 2 non-pharmacare drug will be reimbursed at 60%. So just as a reminder, no one will lose coverage. It's not a pharmacare only plan. It's just a restructuring of different reimbursement levels. So nobody will lose coverage of their drugs that are currently eligible today. And the reimbursement levels will simply change slightly. So in closing, as I want to reiterate, most of the drugs will have increased coverage and will increase to 80% under this new modernized drug plan. Even though some drugs may have less coverage, you can discuss pharmacare formulary options for your condition with your doctor. So we're not expecting you to rush out to do that. And that is why the grace period is available to you for 2022. All other health benefit program rules still apply, such as deductibles, dispensing fee caps, plan maximums, generic pricing, reference-based pricing, the mandatory biosimilar utilization, and the lifetime maximums. I want to remind you that those rules have always been in place and they will continue going forward. Drugs on Green Shield's prior authorization list still require approval from pharmacare. If it's a special authority drug and you receive special authority approval from pharmacare, you do not need to get approval on Green Shield's prior authorization form. But if you're denied by pharmacare or it's a drug not eligible, a non-benefit of pharmacare, then Green Shield will still need to approve your drug before it's covered. And that's only the more expensive drugs on Green Shield's prior authorization list. The tiered formulary will save you and the plan money and will allow more room for other benefits under your lifetime maximum. How the plan is saving money and how will that benefit you? The coverage under this new design is more financially stable and will survive longer. If your plan spends less money on your benefits and shifts those costs over to BC Pharmacare, it will take longer to reach your lifetime maximum and you'll have much more room under that maximum for other benefits and for a longer duration of time. And finally, the modernized tiered formulary will help protect your retirement group health benefits so they are available for you and others well into the future. So with that, I will turn it over to Nikki because we have time now for a question and answer period. And thank you so much for your attention over this past hour and a bit.
Great. Thank you, Joanne. So just as a reminder, we are going to post a Q&A of your top questions to the plan website in the coming days. So please look for that after this session. So our first question is back to Tom. Are these changes being made to the health plan as a result of the pandemic?
No, actually, we started on the redesign process long before the pandemic arrived. And actually, one of the surprising effects of the pandemic is we actually reduced expenditure, not in the drug area, but in the paramedicals, the chiropractors and massage practitioners and such. When in 2020, we were all asked to stay home unless we absolutely needed to. Fewer people were visiting and making claims. The short answer is no. There's no connection between the pandemic and these modifications.
Okay, thank you. Our next question is for Joanne. Joanne, could you please review the deductibles in the example? I'm confused by who pays what amount.
Okay. We start with Mr. Parker with the $50,000 net household income. So Pharmacare has a deductible for all British Columbians, and for all of us, it's around 3% of our net family income. How it works is once anyone starts filling their prescriptions from January 1st, so the deductible resets every January 1st, calendar year. As you accumulate up to the $1,500 worth of prescriptions, after that deductibles, and that $1,500 worth of prescriptions will be paid for by the plan. It'll be paid for by Green Shield, and at whatever percentage, whether it be 80% or 60%, depending. Actually, this is we're doing an example of a Pharmacare drug, so it will be paid for at 80%. So a plan member who's under this extended health benefit plan will not have to pay this $1,500 deductible out of pocket. That's just a deductible that's calculated by Pharmacare. All pharmacies submit to Pharmacare, so Pharmacare is calculating this deductible. And once a plan member reaches the $1,500 in accumulating drug costs, total amount, then what happens is Pharmacare then starts paying 70% of their next prescription after $1,500. So this member who's on multiple medications, or maybe they're only on one drug that is very expensive and it costs $1,500. When he picks up his next, and for that $1,500, it'll still be covered by the plan at 80%. So he will only pay the 20% out of pocket, okay? But the total amount is $1,500. When he picks up his next prescription, which is $1,500 because it's a very expensive medication, then Pharmacare will pay 70%. So it'll automatically go to Pharmacare at the pharmacy. And then 30% of the $1,500 would be paid for by the plan. Then there's another deductible, or annual family maximum threshold, which is $2,000. So when he fills that second prescription, he will reach the $2,000. So the 30% that he's paying, he still has another $500 to go. So the 30% portion that's not paid for by Pharmacare, once that accumulates to $500, then after that point in the calendar year, 100% of the costs of any prescription thereafter that's eligible with Pharmacare will be paid for 100%. So then the plan pays $0 and the member pays $0. I know this sounds very complicated, but I think for simplicity, this all happens behind the scenes in terms of these calculations, because all of the prescriptions that the pharmacies submit in British Columbia, it all goes to Pharmacare. So Pharmacare in the back end is calculating what every individual's deductible is. And that's going to vary by household to household because of the differences in net family income. But what this means is everybody, the more you use Pharmacare drugs, especially the more costly ones, if you do reach your family maximum, then the plan pays $0 and you pay $0 for the rest of the calendar year. And that's where you save money. And many of these drugs cost over $5,000 a year. So when there's coordination with Pharmacare, the plan and plan members save quite a bit of money. So I hope that was helpful.
Great, thank you, Joanne. We're going to go to this question. Our family never applied for Fair Pharmacare in the past, as we appeared to be ruled out based on household income. I take it we all need to apply for it now, as our Green Shield plan is tied to Pharmacare?
We encourage everybody to apply to Fair Pharmacare. And if you haven't, it could be sometimes if the Green Shield has a threshold. So if you accumulate to $700 or $1,000 within a calendar year, then you will be encouraged to, they will not fill any more prescriptions until you've proven that you've applied to Fair Pharmacare. But many households do not accumulate very much. So even if you apply to Fair Pharmacare, you wouldn't hit your deductible anyway, so the plan wouldn't save money. It's more the individuals who have thousands of dollars of prescription claims where it will help.
Okay. So here's a question that would also probably help clarify for some people. When I registered for Fair Pharmacare in 2006, I had a much higher income. Does my deductible now change because I'm only receiving my pension?
Absolutely. So once you've registered, you only need to register once, and Fair Pharmacare has access to your income tax information. So they will adjust your deductible based on your 2 years previous income, net income.
Okay. So here's another question I'll direct to you, Joanne. Can you clarify net income? My husband and I have a significant income, but also have very high medical expenses that take up most of our income. Would cost be based on income minus medical expenses?
That's a good question. It's there's a specific line on the income tax form that Pharmacare uses. So maybe we can take that away because I'm not an accountant. I don't know whether it's based on a net income prior to deductions for medical expenses.
Why don't we flag that one through the Q&A that we'll
Yes.
put on the website? Okay, so please look for that. Our next question is, I have a drug that I use that is not the first choice in a category because I had a bad side effect. This happened again with the second choice and I ended up with a third choice. If that third choice is more expensive, will I still be covered at 80%?
It would depend of the third choice. I'm assuming the drug is not covered by Pharmacare because this individual had to go through a series of different drugs. So what I also want to point out, that's a good question because it brings me to another point that I want to call out to folks here. And that is, if there is a case for you requiring a drug that's not on the Pharmacare formulary, your doctor can actually apply to Pharmacare to build a case and explain why you need that third line drug because you've tried the other drugs and you were not able to tolerate them. To give you an example, when the nurses union went to a Pharmacare tie-in, the example I used of a drug that's not covered by Pharmacare is called Xolair. But when they transitioned to the Pharmacare plan, many of the physicians appealed Pharmacare's decision and they applied to Pharmacare to get approval for Xolair, and Pharmacare did approve many of those Xolairs, even though it officially is not a non-Pharmacare drug. So there's always that possibility. If you're not successful in getting Pharmacare approval for your third line drug, then it will be paid at 60% in 2023 after the grace period.
Thank you. So our question is, I am a diabetic and on other meds. So back in June, my drugs are paid for at 100%. I assumed Pharmacare was paying for them at that point. Is this not so?
There's also, the plan might have been paying for it. So it was one of the earlier slides, but once you reach $2,000 worth of paid claims under extended health benefits, so that includes non-drug benefits, everything except dental, once those paid claims reach $2,000, then the plan covers 100%. So the change will be that if your drug is not covered by Pharmacare, you will stay on tier 2 and be covered at 60%, but on the tier 1 drug, the Pharmacare drugs, those will go up to 100% once you reach your $2,000 accumulated paid amount. So if you had $2,000 in physio, for example, after you pay your $250 deductible, then all your drugs, if they're with Pharmacare, will be paid at 100%.
Okay, thank you. So here's our next question. Presently, the existing plan offers 80% coverage for drugs from discount pharmacies like Costco. Will there be a similar discount offered with the new plan?
So this new plan does not have a Costco preferred pricing. It's flat. We decided to put everybody at 80% for pharmacare drugs.
Okay, let's have a question for Tom. What is the plan's lifetime coverage?
Yeah, so the lifetime coverage under the plan, that is the lifetime contribution from the plan to defray the costs of an individual's drugs and therapies, is $250,000. And you may recall Joanne emphasizing that by engaging in the Fair Pharmacare program, that $250,000 is likely to stretch much further because the plan is bearing fewer costs. And if you go back further in Joanne, I think it was her second slide, one of the principles of the design of the plan was avoid catastrophic coverage, avoiding coverage that imposes expenses on plan members that are so significant that it affects their standard of living through financial considerations. And so those two things taken together, the recent increase a year or two ago of the lifetime maximum to $250,000 and the integration of this plan with pharmacare has been a substantial enhancement to the plan from the perspective of members with large drug costs.
Okay, thank you, Tom. Our next question is for Joanne. Is the BC Pharmacare deductible based on the total cost of the drugs covered or only on your part that you co-paid after Green Shield paid their coverage?
Total cost. So it's based on total eligible costs of drugs on the pharmacare formulary. And I want to remind you that you do not, plan members under this benefit plan do not pay out of pocket for the pharmacare deductible. You pay the $250 plan deductible at the beginning of each calendar year, but the deductible that's calculated behind the scenes, the pharmacare deductible, which is 3% of your net family income, is paid for by the plan. So those drugs are still covered with the same plan rule. So they would be covered at 80%.
Are drugs
Even though you're still under your pharmacare deductible. I just want to make sure that that's understood.
Okay, thank you. Are drugs not covered in the BC Pharmacare formulary, but covered at 60% with Green Shield, not counted towards the BC Pharmacare deductible level?
That's a great question. And no, they are not. Only drugs that are eligible with BC Pharmacare will accumulate towards the pharmacare deductible.
Okay.
The 60% are outside of that. The non-pharmacare drugs will be outside of that.
Okay. So here's our next question. If a person asked for special authority from a family doctor, how does the person know it gets approved? This is after the fact of getting a prescription filled and the person pays the full amount.
Yeah, no, that's a great question. So the pharmacies know if somebody is approved. If they are approved, that approval will transmit directly to Green Shield. So then Green Shield system will know it's approved. It'll transmit to them and Green Shield will pay at 80%. Sometimes there are delays in approval as well. So they can always call PharmaCare to ask what the status of their application is.
Okay, thank you. Okay, this is a question about DIN. Is it mandatory for the drug identification number to be on the label of every prescription?
By law, it is. Yes.
Okay.
That is the key identifier for drugs.
Okay. So here's maybe a tougher question. Why are compounded drugs not covered?
The plan follows Green Shield's compound policy. So Green Shield has certain rules around which compounds they cover and which ones they don't, but nothing will change around compounds.
Okay.
You will get the same, compounds will be covered at 80%
Thank you.
if they are eligible. So this is the same rules are still applying with respect to Green Shield rules under this new design.
So here's a good question. What is meant by co-insurance?
Oh, so co-insurance is the level of reimbursement. So 70% is your co-insurance because the plan covers 70% of the cost of your extended health care benefits. So your prescription drugs or when you go to physio, that is considered co-insurance.
So the next question is, how does the secondary plan cover the remaining cost? Is it based on 100% of the drug cost or only on the portion of the remaining cost?
Only on the portion of the remaining cost. So if it's the primary member, if you have a non-pharmacare drug, your plan, and it's $100, Green Shield will cover $60. 40% of it will the $40 will flow over to the spouse's plan. And it depends on the rules of the spouse's plan. They may or may not cover it. And if they do cover it, then the spousal plan will pay the 40%.
Okay. Here's a question for Tom. Tom, can you tell us who decides which vaccines are covered? I'm thinking specifically of the shingles vaccine.
Yeah, so we receive input from plan members all through the year. And then at one meeting of the benefits committee, each having that correspondence, and we often make adjustments to the plan based on the input of the plan members. And this is a very good example of when that occurs. Vaccines are something that we examine at those sessions and decide upon once a year. So the very short answer to the question is, it is the board of trustees of the plan that makes that decision.
Thank you, Tom. Joanne, is a drug without a drug identification number covered at all?
Well, if it does not have a drug identification number, then that means it's not approved by Health Canada. That being said, there are supplies, there are compounds, there are other types of products that are not necessarily drugs, and they have what we call product identification numbers or PINs. And some of them may be covered and some of them may not be covered. It depends on Green Shield's rules, and all of those rules will still apply. But for prescription medication, it must have a drug identification number for the safety of Canadians. Otherwise, it's not approved by Health Canada.
Okay. So Joanne, if the user is not paying the pharmacare deductible, who is?
Green Shield will pay the pharmacare deductible according to the co-insurance or the level of coverage, whether it be, if it's a drug that's contributing towards the deductible, then that would be a pharmacare eligible drug. So it would be paid at 80%.
Which is to say the plan pays it.
Yes, the plan through Green Shield.
Okay. We're going to end with this last question. Do you automatically get household income information?
Do they mean Green Shield or?
We do not get information about household income related to our plan members. We have no access to that at all. The only place in this entire process and arrangement where that kind of information would be available would be to the pharmacare program. And as Joanne mentioned, it's updated each year as income tax forms are filed, and it affects the deductible level. But no, the plan has no information on family income, family circumstances. And that's, another reason why Joanne was saying, please, if your address has changed, give us the recent address. We are constantly having this problem of staying in touch with members. because we don't have automatic access to these kinds of things.
So that is a great call to action for everyone attending today. Please make sure we have your correct address on file. And with that, this wraps up our webinar. We are so happy so many of you were able to join us today. Thank you for taking the time to participate and for your thoughtful questions and comments. So as a reminder, if you have a personal question about the changes you learned about today, please contact Green Shield Canada. We will enter Green Shield Canada's contact information again into the chat so you can take down those details. Thank you again from all of us here at the BC Public Service Pension Plan. Take care and goodbye.